Welcome, I'm Dr. Jessica Ilani, and these are the American Headache Society Leadership Development Series videos. And I'm here with Dr. Anna Pace, and she's here to talk to us about leading a fellowship program. Thank you so much for joining me. I really appreciate you being here with me today.
Thank you so much for having me.
Yeah, so tell me, what's being a fellowship director like, and is this something you always thought you wanted to do?
Great question. So I always knew I wanted to be in education and hold a leadership role within education. I wasn't sure exactly which level of trainees I was hoping to work with, whether it was medical students, residents, or fellows. And part of I guess one of the best things about being a fellowship director is I get to really work very closely with our fellows one-on-one all of the time, get feedback in real time about how the program is running and kind of get a great pulse for what's working, what's not working, and really just get to see them grow over the year and really just become the best headache specialist that they can be.
I think that's really awesome. It is funny though when you work with fellows, they're very honest because it's such a small, it's not like huge, so they can be super honest and give you day to day. It is a challenge not to like change the program instantly, and sometimes one can muck around with the program because they're like, I hate the way this is working. Do you ever fall into that trap of they tell you I don't like this and then you change it right away and then it doesn't work?
I don't know that I necessarily have changed things right away, but I kind of try to get some more data points and maybe ask one of the other fellows. We do have 2 in our program. And then also go back to previous fellows who have graduated from the program to say, do you agree with this? Is this something that you also thought was kind of a sore point in the program? And how would you suggest that we think about changing it in the future? And then also try to get information from other stakeholders about that change before making it. But you know, it's always a work in progress.
Yeah, I think those are good points. Don't be fast to make changes, but get data points. So how did you move into the role of fellowship director?
So I was really early in my career, and as I mentioned, I was really interested in an educational leadership role, and I made that very clear to my chair in addition to kind of my other colleagues. And one of my colleagues who happened to be fellowship director at the time had decided to pursue another endeavor and happened to put my name into the chair as a good suggestion to take over the fellowship, and they agreed and kind of just dropped on my lap a little bit. I didn't feel as prepared as I was hoping to, but then once I did get that position, I was very excited about it and had so many creative ideas about things I did want to change and what I wanted to improve on. So it was really, I think, a really nice kind of just blessing in disguise, I suppose.
Yeah. So what does your day-to-day look like as a fellowship director?
So a lot of it is emails. I do send lots of emails to our fellows and to the faculty about the schedule, who's with who, when feedback is going to be. I check in with the fellows when we're in clinic. I'm observing them doing procedures, also checking in with them and making sure that their slides are ready for their fellows conference that they give at noon, checking in with them about, do they know when they're on call and those kinds of things. So it's a lot of just day-to-day organization of tasks and delegating and making sure that they're up to date with their, reporting of their hours and those kinds of things. But then on the back end, when it's not necessarily in clinic, I'm thinking about what does the curriculum look like? Are we teaching exactly what we should be teaching them? Are they enjoying the fellowship? How's their mental health? Can I be doing anything else to kind of help them succeed? Are we thinking about jobs early enough? Are they prepared for their boards? And just I think of them as like my little children, and I'm thinking very forward about what can I do to continue to prepare them for success.
Yeah, I often talk to my fellows and tell them, you're like my babies, and I want to make sure you're going to be successful as if you're my own kids. And I'm not sure they always appreciate that, but it might be the motherhood in me coming out. But I do think these milestones are very important. You mentioned so many things that are important: the mental health wellness check-in, the making sure they've done the things they need to do. At our institute, flu shots, something one does not think about, but the checkbox mandates that your institute wants done must be done. And so our fellowship director has to even take care of those tiny tasks to make sure that they're completed. And also making sure that you've put in for vacation time and that someone is covering you. And, do you understand how to use the system properly? And if you're having problems, to come to us at the right time, not when it's too late and the patient's issues aren't being addressed. So I think all of these things are really important. So I know you've walked into a fellowship program that already existed, but if someone is interested in maybe making changes to a program that exists already, you know, what you again have already mentioned a couple of great things like taking data points, hearing a pulse, not just instantly making changes. What kinds of things do you think are important to look at in a program to make sure it's healthy and sustainable? What kind of checkpoints are important? What kind of data points are important? And who are the stakeholders? Who are these stakeholders you just mentioned?
So I'll start with the second part of that question first. I think it's a little easier. So I think the stakeholders really are obviously the fellows, the faculty who the fellows are working with, the department or the chair, any other additional leadership, the administrators, our ancillary staffs, our MAs, and our patients. So, you know, if there are changes in the way we think about our clinical workflow with our fellows, are fellows seeing patients only X number of days? What does that look like for our scheduling and our assistants and how they're telling patients, you know, where they're going to put them in terms of their procedural, you know, appointments versus their follow-ups? If we're thinking about kind of message coverage and call, how does that affect, you know, everyone who would typically be looking at those messages? And do we need to tell our patients that our fellows are going to be looking at those messages first? And then in terms of data points, I think I like to look back historically and then project forward. So I have the, you know, fortunate ability to have had multiple fellow classes prior to me starting as fellowship director, and then now a number of them since. And so what I've tried to do since I started fellowship is actually kind of keep record of feedback that I've gotten from the fellows about various different things that they felt could be improved on, could be changed, and then look over time at whether or not there are similar themes across the years, if there was a very specific thing that changed as a result of an extenuating circumstance like the pandemic, for example, and then kind of look at that longitudinally and see, well, is this something that I think will continue to become a problem or continue to be kind of a sore point in the program, or is this something that, you know, we can realistically make that change now and then try to involve all of the stakeholders in that process. But I think also coming up with creative ideas on how to address the problem. And sometimes I ask the fellows straight away, I say, you know, you're bringing this concern to me. How would you suggest we handle this? And kind of listen to them and see from their perspective what makes the most sense for, you know, this particular concern. And then I think about whether or not that's feasible and then include the stakeholders in that decision as well.
Yeah, I think it's great to hear about all the feedback points and also involving the fellows in the conversation, because it is important to realize that fellows aren't residents and they're not medical students. They're already done with a lot of their training. And so I feel like it's a nice point of understanding that you're about to be in the real world very soon, and having skin in the game is important as well. So what is your feedback? How do you want things to change, and how would you fix your problem that you're having?
Absolutely. I mean, I love feedback. I probably do too much feedback with our fellows, but they're used to it at this point. But it's both ways. I ask them feedback about how the program is going, while I also give them feedback about how they've been doing too.
So Anna, this doesn't have to be a personal answer on your behalf, but in general, if one does a fellowship, you're running a fellowship program, what are the kinds of next steps you can launch from there? I would imagine you're not going to be a fellowship director forever. It's exhausting work, the same way a person isn't a residency director forever or isn't chair forever. Where have you seen friends of yours that have been fellowship directors in the past, or where can you see paths forward? Do you think this is a good launching ground for different opportunities in the future?
Yeah, absolutely. I mean, I think if someone who's particularly inclined in the education or medical education realm, I think it's just the beginning of leadership positions that one can hold. You know, I think in fellowship in particular, you're dealing with kind of a smaller cohort of people that you're responsible for. So thinking about, well, what's the step above that? You know, perhaps becoming, you know, a bigger leader in the American Headache Society of all of the fellowships across the country. In addition to maybe thinking about, do you want to, you know, pursue a leadership role in the medical school where becoming a dean might make sense, or, you know, some kind of leadership role in that sense, or, you know, even thinking about how can we train fellowship directors? So you may be a fellowship director now, but maybe you really enjoy mentoring people who are fellowship directors. So maybe creating a position that perhaps doesn't exist, but mentoring people who are interested in going into that role.
That's a great idea. I was just going to ask you, like, how do you actually end up getting trained? But there really isn't a way. It's
Not
kind
really. You kind of just figure it out as you go. And I think, just speaking with mentors who have done this before and doing lots of research, and I very strongly believe in leadership training, regardless of the type of role that you're in, because I think it really offers the ability to kind of look introspectively on your communication skills and your communication styles, and also teaches you conflict resolution in addition to group dynamics, which is really just incredibly crucial to being a leader regardless of what area you are leading.
I love the idea of leadership training. Here we're talking about leadership in general. Where have been places you've gotten leadership training from?
So I speak about this all the time, but the American Headache Society has the Emerging Leaders Program, which I was very fortunate enough to have been accepted to participate in, and I really do think it was game-changing for me. I learned a lot about myself as a person, and was put on the spot a little bit during the training in terms of public speaking and, trying to navigate group dynamics with a project, which I think is just incredibly invaluable. I'm also currently in the American Academy of Neurology Emerging Leaders Program, which is kind of dovetailing nicely with this. And again, just really thinking about how I lead and how people that I work with kind of feed off of my communication skills and style. And also thinking about ways I can improve on my skills and my teaching so that I'm the best leader and educator for the people that I'm working with.
This has been a really amazing conversation. I think our membership is going to learn so much and grow from this as well. Any last pointers you want to make for our members who are interested in maybe becoming a fellowship director?
It's the best. I love it. It's one of my favorite parts of the job. I think it's really important just to have an idea of what makes you happy and what you will find fulfillment in. So if that's something like leading a fellowship, great. If that's something like really pursuing more research, do that. I think it's really just following your internal passions and also thinking about what your values are and where you see yourself in the future.
Well, thank you, Anna, so much. I'm so glad that you were able to join us for this. And thank you to our viewers and our members. I hope you've gained some valuable information.
Thank you so much for having me.